I think Sharp really can make an impact working with people who still have quite significant needs. So seeing people in the low intensity treatment team was a large caseload, and some of the people who were within that service had reached a level of stability that they didn't need to have a care coordinator. They were attending for their medication, but they still had significant recovery needs and needed a service that could really help them to kind of progress with the next bit of their recovery, which was more than coming for medication. So it was looking at their goals, their ambitions, aspirations, and things that they would like to do.
The impact Sharp has made, I think, is well recognised across the trust, just in terms of delivering what I said we wanted it to deliver, which is to deliver easier access to psychological and occupational therapies. It's also been involved in a number of research programs, the Avatar being one example of a program that really couldn't have happened, or would not have been very easy to have happened, without Sharp. So I think it has made a really significant contribution to the service delivery in Lepus.
Accurately will be to refer to data, so for me, as the service director, I would be interested, in what the data is telling me. So if I'm going to be looking at impact, anecdotally, I know a lot of service users and some of the other services that you interface with make reference to how useful or helpful Sharp has been to individuals and to services, so I know that anecdotally. But if I'm looking at it, sort of the impact in my role as a service director, then I would need to be able to relate that to outcomes or some sort of evidence. And I haven't had the benefit of reviewing any of that lately, so I think it probably will be the kind of situation where I'm confident it would have had an impact, but the extent of the impact, whether it's in the well-being of the individual patient, how many of them are kept out of hospital as a result of being engaged with Sharp, how well you interface with the other community teams or other services generally. I would need to refer to the data to be able to reference the extent of the impact.